So Mesmac is a sexual health charity, and we started over 25 years ago in response to the HIV crisis. We work primarily with most at-risk populations, and when we first started, we worked primarily with men who have sex with men. And now we are all across Yorkshire, so we have offices in Harrogate. For York and North Yorkshire, we've got York, Harrogate, Scarborough, Selby, and North Allerton. So we offer support primarily to people who would be most at risk of acquiring HIV. So that would be men who have sex with men, that might be BME population, could be sex workers, anybody who, intravenous drug users, anybody who would be engaging in higher risk sex. We would like to be able to offer quality sexual health care to people who are most at risk, who might not be able to access mainstream health care. We also, our focus is very much on prevention and offering options for reducing risk of acquisition. It's really important that these services our service is essential. So people who access our service are not accessing services through mainstream healthcare. And that means they're not being tested for HIV, which means HIV could be living in their body, or other STIs could be living in their body, and they're not being treated or not receiving access to proper health care to be able to live healthy, normal lives. So we want to be able to give that opportunity to people, make it an equal playing ground for everybody. So we have our regular drop-in services where you can just come and get a test, but we also have specific drop-in services for BME people. We have a drop-in for trans and non-binary people. We have a drop-in for sex workers, and we also have a drop-in for a married men's group. Alongside of those drop-ins, sometimes peer support will happen amongst those groups. We also have other community groups that use the space, such as Generate, which is a peer support group for trans and non-binary people. We also host a LGBT youth group here bi-weekly, and we have other spaces available for community groups who might like to use.